Now we're going to cover arterial bleeding in the workplace. In this setup, what we saw is a person who knew he probably should have used something to help put the wood through, but the problem was it was inconvenient, which is so common, puts it down, uses his hand, but slips and cuts his radial artery. We know that it's an arterial bleed because it's pulsating and bright red in color. Venous bleeding is more oozing and is darker in color. Now, when we come across this, most people automatically, they grab their bleeding part of their body. They put a hand over it. That's natural, it's normal, but they may not even have a bandage. So when we respond, we're going to make sure our scene is safe, the machinery is off, our gloves are on, and we're ready to rescue. I like to come at least with a 4x4 or a 5x9 immediately. Sir, I'm going to go ahead and replace your hand with this 4x4. Ready? Go ahead and change it out. Now we saw that it was obviously pulsating. Go ahead and put pressure on that right there. There you go. He puts direct pressure himself. He can assist as long as he's conscious and not losing responsiveness. I can see that it's already leaking through, so I don't take the first one away. Go ahead and cover that now. And I put a second one on there. He puts firm pressure. Getting it above the heart was something that we used to teach, but again, if they're not comfortable doing that, it's more important to put the direct pressure instead of worrying about elevating it, all right? We're sitting the person down so that if they do get a little lightheaded, they're in a sitting position, eventually maybe a chair, and if it gets real bad, we'll lower them all the way down to the ground. Now, once we have controlled the bleeding, and it's not like arterial bleeding cannot be controlled with direct pressure. It's something that we need to keep an eye on. Every time we see it starting to leak through, we put another fresh bandage. Here's a 5x9, go ahead and put direct pressure there. And now we see that it's not leaking through this 5x9 bandage. If we could not control this arterial bleeding, we might move to a proper tourniquet device. This is for delayed emergency response of greater than 10 to 15 minutes, major arterial bleeding that cannot be controlled, and life-threatening bleeding that if we don't stop the bleeding, the person's going to lose their life. That's the proper use of tourniquets and when to use them. In most cases, direct pressure and pressure bandages are going to work just fine. You can also make a makeshift tourniquet if you don't have a proper tourniquet device. In this case, we're controlling it with direct pressure. Now, it's not leaking through. The person's consciousness is fine. He's responding to me well. He's still helping. And now I'm going to go ahead and wrap this, sir. I wrap it from the distal end, which means all the way to the end. I start at the end of the extremity. I'm using an ACE wrap to hold pressure with this, so it could actually work like a tourniquet by accident. Not my point. And I'm going to show you how to check to make sure we're not causing a tourniquet in just a minute. But I'm able to wrap that pad in place. Look if I need a little extra pressure once I get over the wound itself, I do a little twist. Then I come back around, another little twist straight over it, and now I can finish out that bandage. And now I just tuck the end into the actual ACE wrap to hold it there. Now, I want to check nail beds. I squeeze the nail bed and look at this. You can see that when I pinch the nail bed and it blanches white and then I let it go, it only takes like 1 to maybe 2 seconds to refill with blood. That's what tells me this is not so tight that it's cutting off circulation, but it's tight enough that it's holding direct pressure and keeping the arterial bleeding from still losing a certain amount of blood. So this is a great bandage. Now we can decide whether we're going to transport this patient to the emergency room by private vehicle or whether we need to activate EMS. At the point that this person started to lose consciousness or show signs of shock like cool, pale, sweaty skin, decreased level of consciousness, or I could not get this bleeding to stop and they were losing a large amount, that's when I activate EMS by calling 911 and get help on the way and treat the patient for shock or any other life-threatening conditions.